All right, ladies and gentlemen, we've got a feisty topic today. We're going to discuss the topic, why are my hips out of alignment? There's a lot here, and as most of you know, I have my physical therapist background, my clinical doctorate in physical therapy, not chiropractic. However, I get asked these questions all the time, so therefore I felt it's prudent at some point that we provide this attention head on so that we can address it. So first off, we have to kind of speculate what it really means. I think I've heard various different meanings of what my hips are out of alignment actually means depending on different providers. I would suggest too, when you ask your professional, your hips are out of alignment, I would dig deeper and I would really want to know exactly what that means. Because I've had some people tell me that, and I'll go ahead and take off some of the muscle tissue here. Some people tell me that the actual hip joint is not in place. Some people tell me that instead of it sitting there, they might say it's like sitting too far forwards or sitting too far backwards. And so in my terminology, and I'll write this up here in a second, I'm kind of questioning, do they really mean that the hip joint is subluxated? Which means it's not dislocated, but it's kind of out of its way. It's not in the position, it's not centered. To be honest with you, even a subluxation in the hip joint would be incredibly rare. The joint capsule, which is what kind of holds the joint together, I like to think about it as the analogy of aluminum foil around a baseball, but enough to allow the baseball to still kind of rotate in there. That keeps everything really tight and kind of suction cupped in, right? And what I really hope they don't mean is that they have a dislocation in their hip. The hip joint can be dislocated. I want to say second behind like the shoulder in terms of commonality, but the hip joint rarely gets dislocated, and if usually it does, it's posterior from what I remember. So we have to be clear that we're discussing hip alignment and the fact that it's not a subluxation or dislocation. We have to be very clear on that. Secondly, I think one of the more common questions that I get about the alignment practice is going to be based upon where your pelvises are actually at. So I think sometimes when people discuss my hips are out of alignment, they're actually pointing to the pelvis. And just to kind of give us a line here, that's kind of a general line saying that we've got, I guess I'll use the term alignment, that the iliac crests are kind of parallel with each other and not one is higher than the other. However, there are times where you might find like one hip joint or iliac is a little bit higher than the other. So just based upon the way you're standing, one side is higher or shorter than the other. And in fact, this can even cause a leg length discrepancy, but I'm going to leave that probably for another video, an educational video. So what do we do about it? If you come in and if you tell me that your hips are out of alignment and we've discussed the idea that it's not really a subluxated hip or dislocated, that's not really what you meant, but it was more the latter of what we talked about, where you and your healthcare professional notice that you actually have this discrepancy where instead of it being straight, you've got kind of this discrepancy, this angle. Now what can cause that? Because I can tell you right now, structural discrepancies, actual structural discrepancies, like your femur length is longer or shorter, your iliac crest is longer or shorter, or even all the way down here, your tibia is longer or shorter, tends to be pretty rare in a significant degree. Meaning we all have some degree of variability. If you measured the differences from side to side, you might on average find 1 centimeter, so that's actually quite common. But if you get to be a few inches and it's structural, that would be quite rare. So what are the common causes then of, in my perspective, being out of hip alignment? It's actually some of the back and hip muscles. So one of the strong hip muscles that has a huge player in this is actually your quadratus lumborum. It attaches to your 12th rib and your iliac crest. And based upon the way you're sitting or standing, this muscle can actually get tight. And when it gets tight, it actually can pull up your entire iliac crest, giving you a pseudo discrepancy from side to side. People start to really worry and kind of freak out that they've got something really wrong with them, when in reality, it could be that muscle, or what I commonly find is the psoas. The psoas has attachments to your lower lumbar spine. It's a strong player into the iliac area as well as the iliacus, and they can have some big movements, some big changes in terms of position of your pelvis. So when we discuss my hips are out of alignment, because I get these questions all the time, I kind of want you guys to dig deeper and ask really what that means, what the healthcare practitioner thinks the root cause is, and really what's going on. I'd want to just make sure they are not saying that your hip joints are subluxated or dislocated, because that would be really rare, and you wouldn't be comfortably sitting there talking to them if that's probably the case. And even in case of an unstable hip, I wouldn't really necessarily call it subluxated. It may not be centered right in the hip joint, but it certainly is probably not subluxated. And the more common reason is usually when they take a look in the back and you see that their hands are kind of feeling your hip joints, your iliac crest from side to side, more so your pelvis. Oftentimes it's actually due to a muscular discrepancy in terms of tone, which can be due based upon how you're standing, how you're walking, and actually how you're moving, which can be corrected without even having to do joint manipulation. I'm just being honest here, and I'm just being honest in hopes of helping you guys find the direction that can help you continue to move as best as possible in a non-dependent situation. Thank you guys so much for tuning in. If you have any questions or comments, please leave them below. If you would like to email me, feel free to do that as well. I'm super open to having that discussion with you. Thanks, guys.